What a long day. Oh, hi, Emily. I'm gonna rest for a bit. Why does my head hurt?
You should go drink water.
Wait. Where am I? What is that bell? There's water. What is that feeling?
Jocelyn? Jocelyn, what happened, Jocelyn? I gotta call 911. Hello? Hi, my cousin just fell on the ground.
Okay, what was she doing before?
She was doing laundry.
Okay, is that in the basement?
Yes.
Okay, does she have any symptoms? Was she tired? Was she drowsy?
She was confused.
Okay, and did she complain of a headache or anything?
Yes.
Does she have any redness around her lips or her eyes?
Yes.
Can you get your parents and have them remove everyone from the house? Because there is a big safety concern right now in the house, okay?
Okay.
I'm gonna send over poison control and firefighters immediately. Please stay calm. Okay, I'm gonna be checking for carbon monoxide. Okay, my detector says that there is carbon monoxide and there seems to be no ventilation, so I have to assume that the patient has carbon monoxide poisoning. To prevent carbon monoxide from staying in the house.
This is what I wish I knew about how carbon monoxide is caused. Some of the things could be fuel burning devices not working properly, leaving the car on in a closed garage with no ventilation, lack of ventilation in the kitchen and the basement, use of a generator indoors, malfunctioning of the furnace and water heater.
If her friend wouldn't have called 911, major causes could have happened, such as illness, brain damage, coma, or even death. What is carbon monoxide?
Carbon monoxide is a deadly gas that is odorless, colorless, and tasteless. It's produced by burning fuels like gas, oil, kerosene, wood, or charcoal.
Safety measures to prevent poisoning are very important to prevent injuries to the brain, nervous system, red blood cells, kidney, liver, teeth, and bones. It's also important because poisons are more common than you think. Some poisons include a large amount of vitamins, household cleaners, personal care products such as shampoo, hair conditioner, lotion and mouthwash, houseplants, alcohol, carbon monoxide, and even lead.
Years later.
Through that summer, the work was down. Helena, wake up!
What do you want?
If you don't wake up, I'm gonna call your mom.
I don't care. Do whatever you want.
I don't care. You're gonna stand in front of the class and read this.
Why do you want me to do that?
Because I said so. Do you have a problem with it?
Okay, fine,
If
whatever.
not, you can
Stop.
leave my
Okay,
class.
stop. It's fine. I'll read it. After much thought, Snowball
Helena, are you okay?
declared that the seven
Do you need someone else to read for you?
commandments. I'm not doing this anymore. Like, you're just gonna keep talking to me. I'm not doing
Helena,
this.
you
I'm not
step
doing-
foot
just
out of
stop
that classroom
talking
and you're
to me.
suspended right now. Helena!
Helena, I'm so
What?
upset right now. I just got a call from your teacher.
I don't care.
Are you okay?
Fine, just get out of my room. I don't even want to talk to you anymore.
Fine. Hello? Something's wrong with my daughter. She's not acting like her normal self. She is very agitated and is having trouble reading for her level.
Okay, I can't say what she has yet, but come to my office and I'll do some blood work for you. Okay, thank you. Bye. Okay, we'll do blood work now. Please take a picture of me. You have to okay? Okay. Now I'm gonna take this off. You're almost done. Yes. Like gauze, like bandage. Okay, now try to take 5 minutes and then come back and take your results back, okay? I came back with your lab results and unfortunately we found lead in your blood.
What is lead?
Lead is a chemical element. Lead can cause poisoning, which occurs when a significant amount of lead accumulates in the body, potentially causing various health issues, which I'm very concerned for your daughter, Helena.
How did lead get into her blood?
Well, some common elements can be inhaled dust from lead-based paint. Children can eat or suck on an object that contains lead. It's found in traditional medicine, or it can also be painted and plastic toys that contain lead. Do you think you've ever done one of these in your childhood?
I think it's tap water.
Tap water, ma'am?
Yes.
Tap water?
Yes.
Well, I think we found why she's poisoned. Unfortunately, we will have to leave her here so we could get her studies and tests done this whole day.
What are signs and symptoms?
So some signs and symptoms of the lead in her can include various things like burns or redness around the mouth and lips, burns, stains, or odors on the person, on clothing, or around the person, empty drug bottles or spilled drugs, vomiting, dyspnea, drowsiness, confusion, and seizures. Has she ever had any of these symptoms?
Confusion.
Confusion? Okay. Well, this is very dangerous for her and her health. So, like I said, we will have to keep her here to test her for diseases.
What is poison?
Poison is any substance harmful to a body when ingested, inhaled, injected, or absorbed through the skin. If too much is taken, any substance can be poisonous. Poisoning is intentional or unintentional.
What is poison control and what do you say to them?
Poison Control Center, you can call them at 1-800-222-1222. And when you call them, make sure to include your location, your name, your phone number, and distance to the nearest hospital. You want to include the patient's signs and symptoms, condition, and health problems, as well if they're breathing or not breathing. We want to include as well patient's weight and age, the substance involved, how do you think the substance entered the body, swallowed, inhaled, smelled, injected, skin contact, splashed into eyes, and when you think the substance entered the body. And most importantly, what care was given.
How do you treat someone that is poisoned?
If someone is poisoned in the eyes, you have to rinse their eyes with running water. If someone is poisoned in the skin, you need to remove any clothing in contact with the poison and rinse the skin with running water. If someone has inhaled poison, you need to leave the area and get the person to fresh air immediately. If someone has swallowed a poison, you need to immediately call poison control and do what they have directed you to do. If the person stops responding or stops breathing or has a seizure, call 911 immediately.
Signs and symptoms of someone getting poisoned. Burn or redness around the lips and mouth. Burns, stains, or odors on the person, on clothing, or around the person. Empty drug bottles or spilled drugs. Vomiting, dyspnea, drowsiness, seizures, confusion.
How do you properly dispose of medication?
First, mix drugs with bad-tasting substances like dirt, cat litter, or coffee grounds. Second, place a mixture in a container such as a sealed plastic bag. Third, throw the container in your household trash. Fourth, scratch out all personal information on the prescription label of the empty bottle to make it unreadable, then dispose of the container.
What are effective strategies for preventing accidents and injuries?
Some effective strategies are to keep drugs and harmful products that contain poison far away in high, locked areas. Use prescription drugs correctly. Buy products that restrict children from touching. Keep harmful products in their original containers and do not use food containers. Do not sniff chemical containers. Read all labels carefully before using. Do not leave harmful products unattended when in use. Do not call drugs or vitamins candies, and discard poisonous household plants.
No!